you have a circular muscle that seems to wrap around the eye. It's this circular muscle around the eye. We call it the Orbicularis Oculi. Again, don't be intimidated by names. Just break it down. It's called orb because it's circular, kind of like an orb. And the oculi is for oculus, which means eye. So its name is literally meaning a circular muscle around the eye. And it has one job. Its one job is to help you to close your eye. That's it. It only closes the eye. That's why if you close your eyes really tight, you'll feel the muscle tense up in a circle around your eye. But if you relax it, you'll notice your eyes are still closed because it's actually a different muscle that helps you to open your eyes. It's a tiny muscle embedded in your eyelid we call the Levator Palpebrae Superioris muscle. This helps you to open the eye. But to close the eye is the job of the Orbicularis Oculi. If you notice in the face still, there's another circular muscle here. There's another circular muscle that wraps around the lips, around the mouth. It's called the Orbicularis oris. Again, orb in Orbicularis because it's circular. And in this case, it's called oris for your oral region, which is your mouth. So again, its name literally tells you where to find it. Orbicularis oris is the circular muscle around the mouth. And in this case, it's helping you to close the mouth, or in some cases, purse the lips. You purse your lips when you drink from a straw, or when you're whistling, or when you're about to kiss, you're pursing your lips. That's the job of your Orbicularis oris. Keep going, lots of muscles in the face. If you notice, there are two skinny little muscles kind of running at an angle towards the corner of the mouth. There's something called the Zygomaticus major and Zygomaticus minor. The Zygomaticus minor will have minor in the name because it's the smaller one, and major is the slightly bigger one. And they're both your Zygomaticus muscle. Zygomaticus major and minor. And they kind of give you a hint as to their action based off the direction they're running. They're running towards the corner of the mouth. So when this muscle contracts, its function is to elevate the corners of the mouth. What do you think you're doing when you elevate the corners of the mouth? Well, it's called a smile. Remember, I have to give you anatomical definitions. So simply, your Zygomaticus major and minor help you to smile, but technically, if I were to ask on your exam, say that it helps to elevate the corners of the mouth. Keep going. Lots of muscles still in the face. You even have a little muscle over the chin. Remember, your chin area is called your mental region. So this small muscle sitting over your mental region is called your mentalis muscle. Mentalis muscle. It's partially able to help depress the lower lip, meaning help you to lower your lower lip. But you can also use it to wrinkle your chin. Little babies, whenever they get upset, they always wrinkle their little chins. Turns out babies are masters of using their mentalis muscle to help wrinkle their little baby chins. But anywho, back to muscles. Keep going. Lots of muscles in the face. There's a deep muscle in the face buried under several other muscles. It's called your buccinator muscle. Buccinator. It's called buccinator for buccal, which means cheeks. This is the muscles in your cheeks. And your buccinator muscle's job is to expel contents from the oral cavity. What does that mean? To expel contents from the oral cavity is simply spitting. When you spit, well, that's you expelling or kicking out something from your mouth, from your oral cavity. And you could partially help to do that with your buccinator muscle. Keep going. Lots of muscles still in the face. Go back up towards the head. You saw the occipital-frontalis muscle. Well, off to the sides of the head, kind of sitting on top of your temporal bone, is something called your temporalis muscle. Turns out this muscle will work in a group. Sometimes a lot of your muscles work together. And this one is part of a group that we call your muscles of mastication. What does it mean to masticate? To masticate means to chew. So your temporalis muscle with a couple other muscles will help you to chew. I want you to know two of your muscles of mastication. One of them is the temporalis muscle. So if you were to put your hands on the sides of your head, kind of right above the ear, you'll feel it contract as you're chewing because it's helping you to chew. And continue to chew, and now move your hands down into the face. Where else do you feel it bulge? Well, you'll feel it bulge, muscles bulge, over the jaw. If you notice over the jaw, there's a huge muscle. We call it the Masseter Muscle. It sits over the jaw. It's a powerful masticating muscle. So make sure you know these two muscles of mastication. On the side of the head, sitting over the temporal bone, is the temporalis muscle. And sitting on the jaw is a large muscle called the Masseter Muscle. Those are two of your muscles of mastication. Those are two muscles that help you to chew. Also on this side view of the face, we could see some of the neck. Turns out there's a big superficial muscle over the front or anterior portion of the neck. It's very wide, but it's actually paper thin. It's a super thin muscle over the front of the neck. We call it the Platysma Muscle. Platysma. When you flex this muscle, it makes the neck look a little bit wider. We say in anatomy, it helps you to grimace. When you grimace, it's going to sound weird, but kind of think being constipated on the toilet and you're straining. Whenever you strain, oh, that's a grimace. Your neck might get a little wider. You're just seeing the role or the actions of your platysma muscle. And if you were to peel off the platysma muscle, you'll notice that there are muscles underneath it. And you'll see this throughout the body. There are muscles on top of muscles. You saw the buccinator is buried under other muscles. Turns out there are muscles buried underneath the platysma. And one of those muscles buried under the platysma is a muscle I mentioned earlier. Don't be intimidated by the name. It's called the Sternocleidomastoid. Remember, don't be intimidated. Remember, it told you exactly where to find it. Remember, it's called sterno because it partly attaches to the sternum. It's called cleido because it's partly attached to the clavicle towards the front of the chest. And it's called mastoid because it attaches to the mastoid process behind the ear. And that's what you see. It's this long, skinny, cylindrical muscle running from behind the ear towards the front of the neck at the top of the chest. That's your sternocleidomastoid. You have one for each side of your neck. Why? Because you remember you have two mastoid processes, one for each of your temporal bones. Remember, you have two temporal bones, one for each side of your head. So you're going to have two sternocleidomastoid muscles, one for each side of your neck. And what does this muscle do? Well, simply it helps you to turn the head, to rotate the head. But you got to know a specific definition. It helps you specifically to turn the head to the opposite side, meaning your right sternocleidomastoid will turn the head to the left, and your left sternocleidomastoid will turn the head to the right. So they're pretty much turning the head in the opposite direction it's located. And you can feel this when you put your hands on your neck and just turn. You'll feel the neck tense up on the opposite side of the turn. That's your sternocleidomastoids. And that's all the muscles we're really going to explore in the head and the neck. So we're going to go down a little bit into the torso. When we come down into the torso, again, we're going to see several different muscles here. And like the head and neck, there will be muscles buried underneath other muscles. So we're going to take our time. We're going to kind of try to peel through these different layers and talk about some of these muscles. And like usual, stick to the exam review. So we're going to start off up in the chest. In your chest, you have this big fan-like muscle right in the anterior superficial portion of the chest. It's called the pectoralis major. And if you were to rip off the pectoralis major, there will be a smaller pectoralis minor. It's kind of like the Zygomaticus major and minor. The majors are always the bigger ones, and the minors are the smaller ones in humans. And so you have this pectoralis major and minor. And they both have the same names, at least the first part, because they're pretty much doing the same thing, as at least one similar function. And you might know if you know how to get bigger pecs in the gym. What do you do in the gym to get bigger pecs? Well, you go and you do push-ups, or you go and you do, you sit on the bench and or you do flies at the gym. You're trying to do something, mainly actually with your arms. It's actually in the arm and shoulder. This is how this muscle works. Its function is to help do arm extension. So when you are on the ground doing push-ups, you're basically extending the arm over and over again. And that's the job of your pectoralis major muscle. So it will get worked out and it will hypertrophy and get bigger. So that's the pectoralis major. If you want bigger pecs in the chest, do push-ups, do flies in the gym. All right. Keep going. Come down or look between the ribs. You can see the ribs over on the right side on this image. On this image, like a lot of the other images, on one side, they'll show superficial muscles, and on the other side, they've ripped off the superficial muscles, so you can see muscles underneath. So on the right side, we can see the ribs, and we can see that there are muscles between the ribs. And we name these muscles between the ribs. They're called your intercostal muscles. And your intercostal muscles are actually helping you to breathe. How? They help you to expand your rib cage for breathing, to help the diaphragm, which is the major muscle for breathing. So when you actually eat ribs, you're actually technically eating that animal's internal and external intercostal muscles. They're rib muscles they were using to help their diaphragm, to help them to breathe. But anywho, back to the muscles. Going down now into the abdomen, to where people talk about having abs. Everyone talks about having abs. And when we talk about abs, people talk about having a 4-pack, a 6-pack, a 8-pack. I've even seen a creepy 10-pack. What's going on here? Is this muscle, your abs, really 5 or 6 or 10 different packs of muscles? Actually, no. It's one large sheet of muscle we call the Rectus Abdominis. That's where you get abs from. You're actually saying part of the name. It's called the Rectus Abdominis. And it's a large muscle covering the anterior portions of the abdomen. So how do you get the packs? How do you get it broken up like that? Well, you kind of see a hint in the picture. There's lots of connective tissue that attaches and runs through this muscle. It's all the white you're seeing here. And some of this white is running through like little lines. Like this one going right down the middle of the Rectus Abdominis. It's called the Linea Alba. The Linea Alba is just connective tissue running vertically down the middle of the Rectus Abdominis. But if anything, that just breaks your Rectus Abdominis up into a 2-pack, into a left and right. So how do you get more packs? Well, you see more connective tissue in the picture. It's running horizontally. These little white little horizontal lines are what we call tendinous insertions. And they're pretty much just like the Linea Alba. They're just connective tissue running through the muscle. And this kind of breaks up the muscle into these little pouches we call packs. So turns out the number of tendinous insertions you have can vary. And it will only vary based off your genetics. So if the best your parents could do is a 4-pack, well, odds are that's the best you could do too. Why is that important? Because maybe you might want to become a personal trainer and you're probably trying to help someone to get 6-pack abs, and for the life of you, all you can manage to get them is a 4-pack and they're getting mad at you. Well, you might need to tell them to chill. Maybe they only have one tendinous insertion, breaking up their rectus abdominis into a 4-pack. So knowing anatomy, like usual, helps. And then, now that we know where this muscle is and what it looks like, how does it work? What's the function? Like usual, you might know. How do you try to work out your abs? Well, you do sit-ups, or you do planks, or you do crunches. What are you doing when you do sit-ups and crunches? Remember, I got to give you anatomical definition. So again, this might sound weird. Turns out, the job of your rectus abdominis is to flex the spine. Flex the spine. You flex the spine every time you take a bow, or when you do a sit-up, or when you do a crunch. So when you want to work out your rectus abdominis, you just flex the spine over and over again. Do sit-ups or do crunches over and over again. That's one function. What else? Look at other muscles in the abdomen. Look more onto the sides of the torso. On the sides of your torso are what we call your oblique muscles. You have two of them. There's an external oblique, which is more superficial. And if we were to peel it back and look underneath it, deep to it, we'll see the internal oblique. Remember, their names tell you. There's the external oblique because it's more external, it's more superficial. So you see it off to the left-hand side on the superficial side.